Hydroxyzine is an antihistamine used to treat anxiety and tension associated with psychoneuroses, as well as allergic conditions such as pruritus and chronic urticaria. In this video, let's found. What is hydroxyzine? What is hydroxyzine used for? Contraindication. What are the side effects of taking hydroxyzine? How does hydroxyzine work? How to use hydroxyzine? What is hydroxyzine? Hydroxyzine, sold under the brand names Atarax and Vistaril among others, is an antihistamine medication. It is used in the treatment of itchiness, insomnia, anxiety, and nausea, including that due to motion sickness. It is used either by mouth or injection into a muscle. It was first made by Union Chimique Belgique in 1956 and was approved for sale by Pfizer in the United States later that year. In 2020, it was the 70th most commonly prescribed medication in the United States, with more than 10 million prescriptions. What is hydroxyzine used for? Hydroxyzine is indicated for the symptomatic relief of anxiety and tension associated with psychoneuroses, and as an adjunct in organic disease states in which anxiety is manifested. It is also indicated in the treatment of histamine-mediated pruritus and pruritus due to allergic conditions such as chronic urticaria. Canadian labeling states that hydroxyzine is also indicated in adults and children as a premedication prior to medical procedures, such as dental surgery. It is also used in the control of nausea and vomiting, excluding nausea and vomiting of pregnancy. Contraindication. The administration of hydroxyzine in large amounts by ingestion or intramuscular administration during the onset of pregnancy can cause fetal abnormalities. When administered to pregnant rats, mice and rabbits, hydroxyzine caused abnormalities such as hypogonadism with doses significantly above that of the human therapeutic range. Side effects. Several reactions have been noted in manufacturer guidelines. Deep sleep, incoordination, sedation, calmness, and dizziness have been reported in children and adults, as well as others such as hypotension, tinnitus, and headaches. Gastrointestinal effects have also been observed, as well as less serious effects such as dryness of the mouth and constipation caused by the mild antimuscarinic properties of hydroxyzine. Central nervous system effects such as hallucinations or confusion have been observed in rare cases, attributed mostly to overdose. Pharmacodynamic. Hydroxyzine blocks the activity of histamine to relieve allergic symptoms such as pruritus. Activity at off-targets also allows for its use as a sedative anxiolytic and an antiemetic in certain disease states. Hydroxyzine is relatively fast-acting, with an onset of effect that occurs between 15 and 60 minutes and a duration of action between 4 to 6 hours. Hydroxyzine may potentiate the effects of central nervous system (CNS) depressants following general anesthesia. Patients maintained on hydroxyzine should receive reduced doses of any CNS depressants required. Hydroxyzine is reported to prolong the QT/QTC interval based on post-marketing reports of rare events of torsade de pointes, cardiac arrest, and sudden death, and should be used with caution in patients with an increased baseline risk for QTC prolongation. Mechanism of action. The H1 histamine receptor is responsible for mediating hypersensitivity and allergic reactions. Exposure to an allergen results in degranulation of mast cells and basophils, which then release histamine and other inflammatory mediators. Histamine binds to, and acts, H1 receptors, which results in the further release of pro-inflammatory cytokines, such as interleukins, from basophils and mast cells. These downstream effects of histamine binding are responsible for a wide variety of allergic symptoms, such as pruritus, rhinorrhea, and watery eyes. Hydroxyzine is a potent agonist of histamine H1 receptors. Inverse agonists are agents that are considered to have a negative efficacy. So rather than simply blocking activity at a receptor, they actively dampen its activity. Inverse agonism at these receptors is responsible for hydroxyzine's efficacy in the treatment of histaminic edema, flare, and pruritus. Hydroxyzine is not a cortical depressant, so its sedative properties likely occur at the subcortical level of the CNS. These sedative properties allow activity as an anxiolytic. Antiemetic efficacy is likely secondary to activity at off-target. Half-life. The half-life of hydroxyzine is reportedly 14 to 25 hours, and appears to be, on average, shorter in children, 7.1 hours, than in adults, 20 hours. Elimination half-life is prolonged in the elderly, averaging approximately 29 hours, and is likely to be similarly prolonged in patients with renal or hepatic impairment. Dose. Anxiety. Symptomatic relief of anxiety associated with psychoneuroses and as adjunct in organic disease states. 50 to 100 mg PO divided Q6HR or 50 to 100 mg IM divided Q4-6HR, dosing conditions. Continuation of therapy for 4 months has not been studied, reassess need for therapy periodically. Pruritus. Management of pruritus due to chronic urticaria, contact dermatosis, and histamine-mediated pruritus. 25 mg PO/IM divided Q6-8HR preoperative sedation. 50 to 100 mg PO or 25 to 100 mg IM. Dosing considerations. If treatment is initiated IM, subsequent doses may be administered PO. Nausea and vomiting, off-label. 25 to 100 mg IM. Safety advice. The FDA categorizes first-generation antihistamine drugs based on the risk of fetal defects. Drugs such as diphenhydramine and chlorpheniramine are Class B, promethazine and hydroxyzine belong to Class C drugs due to lack of well-controlled studies on humans. That's all the information about hydroxyzine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.